In this episode, we're going to be talking about your first visit to the dentist, okay? There's a lot of people that they haven't been into the dentist in years, 5, 10, 15 years. So when you come to an office as a new patient, that first visit is going to entail taking some x-rays, what we call a full mouth x-rays. That's an x-ray of every single tooth you have in your mouth or the bony part of your mouth, okay? And that is a very important part of the exam because that's what will give us an idea of the status and the health of your teeth, okay? We can see x-rays in between the teeth, cavities in between your teeth, and any abscess that is inside the bone. We can also look at those, okay? So it's very important that you are prepared for that. It takes about 10-15 minutes for that, and the whole appointment the initial appointment will take about 1 hour. There is a part that the hygienist is going to come and take some measurements of your gums, which is also important because that will give us an idea of the status of your gums. It will let us know if you have any bone loss or any attachment loss, and the attachment is the part of the soft tissue or the gums that attach to the actual tooth, okay? So when the gums are diseased or you have infection of your gums, that attachment and the bone is lost, okay, which is known as periodontal disease. So when you come to that first visit, you could be categorized in one of the 3 areas: healthy gums, which means that you will need only a cleaning in addition to any other treatment that you may require. You may have gingivitis, which is an inflammation of the gums. It's not an infection, but if you try to floss or when you brush your teeth, you'll see bleeding. And up to that point, there is no bone or attachment loss. But as soon as a person starts experiencing attachment loss or bone loss, it is called periodontal disease, which is an infection of your gums. And that is caused by bacterial accumulation inside the gums, which in turn turns into bone loss. As soon as you experience bone loss, that's what's called periodontal disease. And obviously, the treatment for that is more than just a cleaning. And a lot of people get confused for financial reasons also, because obviously when you are treating periodontal disease, the cost for that treatment is more expensive than the cost for just a regular cleaning. So it's very important that you are aware of that, okay? If you are diagnosed with periodontal disease or infection of your gums, you're going to have to be treated more in depth. You may need antibiotics inside your gums. You're going to need what is called scaling and root planing, which is commonly known as a deep cleaning. And on that part, either the dentist or the hygienist will go inside your gums and remove the substance, the calculus that is, the habitat for that bacteria. Okay, that's where all the inflammation and all this infection come from. So there are different levels of periodontal disease depending on the amount of bone loss that you have. You may experience mobility on your teeth, just sensitivity initially, but then you're going to start experiencing mobility, which can be grade 1, grade 2, or grade 3, depending on how loose the tooth become. So it's very important that you are aware of that, because if you don't take care of that, and give it a sense of urgency, then you're going to start experiencing teeth loss, okay? So it's very important that you do that type of treatment as soon as it's diagnosed, okay? Once the gums are treated, if you need other things like crown, bridges, implant surgery, or anything major that require the gums to be healthy, we cannot do any of those things until the treatment for your gums is completed, or at least initiated, okay? We cannot deliver any permanent fixture like a crown on a tooth that has not been treated with for periodontal disease, okay? We have to establish that the gums are healthy before we can go to that next step. And I invite you to think about it like when you're building a house. You are going to build a house with good foundation, because if not, you're going to start experiencing problems with that house, right? And the same thing goes for the mouth. If you don't ensure that those gums are healthy, and we go in there and do treatment such as implants or crowns or bridges, then you're going to start experiencing problem with those. And dental care tends to be expensive if you don't have insurance. So you want to make sure that whatever is done and you're paying for is done the correct way. And, if we don't take care of the initial level, which is the hygiene, once you go to another level, if you don't take care of that part first, you're going to experience even more problems than what you have already. So it's very important that patients understand that it's not that we want to take longer seeing you the first time. It's not that we want to, diagnose things that are not there. In particular, in my office, we diagnose what we see, okay? And we are going to do our best to help you achieve your goals of having good oral health, and we're going to provide the means for you to, or help provide the means for you to be able to take care of whatever situation is going on. I have a complete staff in my office that is there to help you, is there to inform you, and is there to eliminate the barriers for your treatment, okay? So I welcome you to come and visit. I don't charge for the exam, for the initial exam. We will do the x-rays are no cost for you if you don't have insurance. If you have insurance, we will bill the insurance for the x-rays. But if somebody doesn't have insurance, at least that first visit will give you an idea where you stand. And I encourage you not to so much focus on the number, but on the situations. And then we can start taking care of the problems as, one thing at a time. We can take care of your gums first. Then after that, we'll take care of whatever the most immediate thing that needs to be taken care of is. We'll take care of that. And then from there, we'll continue to build up on what we continue to do, okay? And before you know it, you'll enjoy having good oral health and forget about the pain that has been causing you to be uncomfortable for a long time, okay? So you're more than welcome to come and see me. My name is Dr. Nelson Nunez. I'm here to help, to answer all your questions. You can go on the on the comment section here on this channel, ask all your questions, and on the next video, we'll discuss some of those topics. I want to provide a lot of information about hygiene and how important it is to keep a good oral health. And also, I want to provide information on the different type of treatments that we offer to replace any missing teeth, okay? I'm going to have some guests here. I want to bring my hygienist so she can sit down and give more information about the different type of situations that you can encounter in your gums, and how she can help you fix all those problems. I want also bring to some colleagues and sit down and chat with them for a while. That way they can give you a different perspective of things that they have seen and how they can be prevented, okay? And as usual, I'm here to answer all your questions. I want to make sure that this is a site that you can come over to be informed, to be aware of the things that could be causing you problems, and also to be informed of the things that we can do to help you achieve your goal, having a beautiful smile and in good oral health. So thank you for joining me, and thank you for supporting this channel. If you don't mind subscribing, hitting like, and share this video, the more people that we inform, the better it's going to be for you guys. So ask any questions you want, and until next time, I'll see you then. And always floss twice a day at least, morning and evening. If you cannot do it any more times than that, I encourage you to do it. Thank you for everybody that has been here and that is supporting the channel. And until the next time, it was a pleasure to be here with you guys. And always remember, like I said, you have one life and one life only. Live it to the fullest. Show love your family, love your kids, and be a good person. be a good person, help those in need. Okay, God bless you all. Be good, be safe, and I love you guys.